Okay, here we go. My horrible Kybella story. The biggest side effect of Kybella is the fact that people don't actually know what they're getting into with Kybella because providers don't actually talk about the side effects of Kybella. Let's see what she has to say.
My horrible Kybella story. So here we go. So this is what I looked like right before I went in.
Okay, so she's got some submental fat there. That's that little fatty area really between the chin and the neck, also known as the double chin. So Kybella is FDA approved for the treatment of double chin. And what it is it's an injectable drug that goes in and emulsifies or breaks up all the fat in that area. The body absorbs it, goes away forever. The other way that we usually treat this is cool sculpting. So cool sculpting does the same thing as Kybella, but in a freezing form. So it's going to freeze that area without the emulsification. Hurts a lot less if there's enough fat there to actually cool sculpt. The body then is going to absorb the frozen fat cells and get rid of it. Then what we would do after that is you'll have a little extra skin there because the fat that was usually there is stretching out the skin. So we do PDO threads to help tighten up that skin of the double chin. And so you have a single chin and a nice beautiful neck, building up that collagen and everything like that. So let's see what she says.
A bit of fat underneath where whatever. This is right before. Okay? Awesome. This is me right after my drive home. So 20 minutes after I got home from this procedure. This. Look at all those little dots. I mean, that's pretty normal looking right there. That is what it's supposed to look like. So this is these.
Okay, so she's absolutely right. We always tell patients with Kybella, you're going to look like a bullfrog after the treatment. And sometimes for a significant amount of time, it could be up to a month that you look like a bullfrog in that area because the Kybella is breaking up all that fat. You have a lot of inflammation in the area, a lot of fat cells getting damaged. So the body is going to react in a specific way. And that is definitely normal looking Kybella. I like how she makes it super dramatic though. It's great.
Same time, just different angle. This is what it's not supposed to look like. What I just showed you is what it is supposed to look like on the sides on right there. He told me he was going to concentrate the product in the middle of my chin because that's where most of my fat cells were. He told me that he was going to concentrate the product so I wouldn't need another service done. So at this point...
Okay, so 6 in one, half dozen the other. You ask 12 different doctors and they're going to give you 12 different opinions on this. My opinion is usually that, Kybella gives you a grid or you draw out a grid that you should inject Kybella based off of. Most of the time, you don't really hyper concentrate the Kybella in one area. However, there are probably injectors out there who are as good, if not better than me, that do concentrate it. So 6 in one, half dozen the other when it comes to this type of treatment. Obviously, she does have a significant amount of bruising in that area, more than usual when it comes to Kybella. However, there is, again, an aesthetic procedure has a wide range. It looks like she's also got her lips done at the same time, which I would never recommend getting done at the same time. I'm not sure though. Let's see.
I'm not freaking out yet. Like, it looks a little funny and I'm swollen like a freaking frog, but whatever, I'll give it a little bit. It doesn't hurt.
Yep, the swelling like a freaking frog, completely normal. Always tell your patients that you will be swollen like a freaking frog. It will go away. Don't worry.
Hurt too bad because the numbing and sensation of the product. And this is what I woke up with the very next day. All these little water blisters are starting to form and it started hurting terrible. The swelling had gone down a little bit, but those little marks on the side right there, that's still what it should look like. All these little water blisters, no, not supposed to happen. And then I just keep looking at these photos and
it looks like a couple different things that could happen. Number one, maybe the area wasn't properly cleaned. And so when you are injecting, obviously breaking the skin, you want to make sure that the area is cleaned multiple times. So we use alcohol wipes. We use sometimes betadine. We also use on top of that, we use Hibiclens, all types of skin cleansers that are going to get the makeup off, really clean the skin so that when you inject the skin and you're using a needle multiple times, it is completely clear and devoid of any type of infectious problems that maybe could have caused this skin infection. Another thing is making sure that the needle possibly could have been put down or something like that during the treatment, causing, an infectious bacteria to be on the needle and cause these blisters.
I'm still just like so in shock this has actually happened. So this is what happened literally the next day. Obviously, a lot worse. I'm starting to freak out, and so I
It looked worse the day before. I think it's actually improving.
call his office. His receptionist says he'll give you a call back later once I talk to him. She asked me my symptoms, blah, blah, blah. Anyways, go back. 5 minutes after I hang up the phone with them, she calls me back and she says, oh, doctor says to just put Vaseline on it.
That's a pretty bad idea.
Vaseline, bruh.
Yeah, I agree with that one. I would probably, I mean, it looks like it's red, irritated, looks like a little bit of a skin infection there. I would definitely do some sort of mild antibiotic to help treat that at this time.
Water blisters. Also, I got my lips done at the same time. Look at all that bruising. I do not bruise like that when I get my lips done.
Well, you don't bruise like that when you get your lips done because you got two inflammatory things done, highly inflammatory things at the same time. One, Kybella. Two, your lips done. We would never recommend doing both of these at the same time because they're going to cause a lot of inflammation. Two things that cause a lot of inflammation, guess what? It's going to cause even more inflammation and even more bruising. And that might also be the results of what happened here is that she had so much inflammation that it did create some sort of, reaction with the Kybella that shouldn't have been there. We always recommend, again, slow and steady treatments over multiple days or weeks. Kybella one day, then your lips on another day, then maybe Botox and some more filler on another day, then threading on another day. Doing it all in one day, trying to push it all in, doesn't allow the face to settle, doesn't allow each treatment to do what it's supposed to do, and can cause a higher risk of side effects, such as here.
My lips done. That is insane. My lips were peeling off like nuts. This is after they popped. I wasn't picking at them. I was literally putting a hot compress on it to help soothe the pain, and
Smart
then they
lady.
popped. Now
She's
this
smart.
is what it looked like after healing.
Okay.
Not as bad as you would think considering the water blisters, but this is what it looks like after the healing. So the doctor...
So all that build up and she said, well, not as bad as it thought. Like, okay, here we go.
Doctor felt badly, and of course I got 3 free IPL treatments done, and this was after the 3rd IPL
So that looks actually pretty dang good.
treatment. So I'm still stuck with scarring. I use hydroquinone, it's a bleaching agent, and retinol daily to help get rid of it, but I still have scarring, and when I'm out in the sun, it gets worse. So be very mindful when you see doctors. I actually wouldn't even see a doctor anymore. I would go and see an NP because they use...
Okay, so a few things. Number one, all that build up for a little tiny dot. Now I understand that little tiny dot was not there before and she didn't have scarring before, but she doesn't even show the after of like her Kybella. It looks like it worked really well and she has a lot less submental fat just looking from the bottom there. And I'm sure she's got a much better chin. I mean, looking at her picture in this video, she's got much less of a double chin, even though she's looking down at this video this whole time talking, which I would never recommend. If you don't want that double chin, always look up. Bring your chin up. It's going to stretch it out, make you look a lot thinner. But she's looking down and you can't even see a double chin there. So it obviously worked really, really well on her. Maybe doing some threading. I would do a little bit extra threading that'll help tighten up that jawline and make it look really snatched. But other than that, I mean, the IPL looks good. It created some good results. I would continue to do more IPLs. I would do the hydroquinone and then I would do some PRP treatments with microneedling. And that'll help lighten up that skin, help refresh that skin, and all that scarring will go away and she'll be left with a beautiful result. Obviously, her lips look good as well. So she was complaining about that and the bruising. It went away. It looks good.
Injectables way more often. Good luck.
Okay, then she talks about going to a nurse practitioner because they use injectables way more often than MDs or doctors do. Look, it doesn't matter where you go to an MD, a DO, an NP, a PA, or even in some states an esthetician. If they're doing it day in, day out, and that is their expertise and they're trained really well in it, doesn't matter whether you go to an MD, doesn't matter whether you go to an NP or PA, you're going to the best people that have the best results and can walk you through every step of the way, then hey, you're gonna get great results. It looks like she actually got great results, and the fact of the matter is she got Kybella, which sometimes people are not prepared for. It is a lot of pain, it is a lot of inflammation, you're gonna look like a bullfrog, you're gonna have some skin reddening, you might even have blisters like she had, but afterwards, the result is what she was probably looking for, which is loss of that submental fat. So it worked in the end. A lot of times patients are uneducated about this, so it's on the providers to make sure that they're discussing this, and on you as a patient to make sure that you're discussing these things with providers. That's why we do these videos, to make sure we educate you on that. So I think she actually got a great result in the end. I think a couple more treatments of the IPL and PRP and the hydroquinone, it's going to clear right up. Obviously, she wears makeup and it looks great. And so I think she did pretty well. Good result to me.
Great success.